In a time when politics and policies are being eroded by greed, power, billionaires, and a judicial system that seems rife with ethical conflicts, it has been hard for me to maintain faith in our system. I'm not just talking about one party or the other. I'm talking about how the entire system has made me question and feel less confident in how our government is run. As a women's health practitioner, legislative policies can deeply affect how my colleagues and I do our daily work. And not just gynecologists, but all physicians are being challenged by corporate medicine, the impact of insurance companies, and changes in Medicare and Medicaid. I maintain that all human beings living in the U.S. should have access to quality health care, but the realities of medical deserts, inequality in access to care, national legislative trends, and the mounting cost of health care all feel rather insurmountable to me at times and prevent folks from the care so many of them desperately need. Yet, despite this gloom and doom, today I am speaking with a politician who gives me great hope. Her service to New York ranges from agricultural protections to women's health and beyond. She serves with integrity, grit, and a humanity that flies in the face of the DC culture that has left so many of us feeling deeply concerned about our future. Welcome, this is GynoCurious. I'm your host and creator, Dr. Amy Novatt. From both sides of the speculum, we're here to investigate what it means to be a healer and to be healed. Please send any questions, comments, thoughts about this episode or any episode to comments@radiofreerhinecliffe.org. And if you're interested in my clinical practice, whether in person or virtually, please go to dramynovat.com. I am so grateful today to welcome Senator Michelle Hinchey. She is a senator who was elected to the New York State Senate in 2020, making history as the youngest woman to represent the 41st Senate District, and has become a leading voice for rural and Hudson Valley, New York communities. In just 4 years, Senator Hinchey has had a record of 85 bills signed into law, focused on expanding rural health care and housing, enhancing local food access, protecting farmland, addressing the climate crisis, and advancing environmental stewardship. Welcome, Senator. Thank you so much for being here.
Thank you for having me. It's great to join you, and thank you for your work.
It's my pleasure. I think we're two women who like to speak out loud about injustices, speak out loud about our passions, and be in the fray. So I'm so grateful to be a member of your constituent and to have you here today. So I'd like to begin each show with kind of just getting to know people from the perspective of their professional arc. And, there's a lot of information about you online, but I wanted to hear from you to share with the audience, kind of just up close and personal. Why politics? That is not a world that many folks will enter, but yet you're there and deeply, involved with the work you do. What sent you to the Senate?
Thank you. Yeah, well, and not a lot of work that people want to do right now when we're so divided, and there's also so much both uncertainty and distrust and mistrust, honestly, rightfully so, at so many levels of our government. And though for me, I grew up in this community. I'm born and raised in Saugerties. And so the whole, Hudson Valley and Ulster, across the bridge over to Rhinebeck, this is where I grew up. And it's a beautiful place. It's an incredibly special place to call home. And I grew up immersed in public service and seeing what public service can and should be, bringing people together, having tough conversations, but working with people to actually get stuff done that improves people's lives. But I also saw all the negative sides of it, of which there are many. And For me, I ran from government and from public service for a long time. I wanted to see what else was out in the world. And so, I'd been asked, for those who don't know, my father was in office here. He was first in the New York State Assembly and then in the US House of Representatives and Congress for a long time, pretty much my whole life. So that's how I saw it really up close and personal. And so, I had the privilege of being asked, if and when I would run really since I was like 7. So it was always in my mind, which again is a privilege to kind of have that thought that, you could do it, even though the steps of doing it are extreme, right? Just knowing that it was there. But I wanted to see what else was out there in the
Mm.
world. And, 10 years working in communications for technology companies and media companies. And I just always truly felt like there was more to do at the end of the day. Remember I went to high school and I had, garbage cans collecting water from the leaky roofs and the leaky pipes, right? The challenges that plagued my community, decades later were still there.
Mm.
And if anything, we've seen, access to things like healthcare and other things that I too consider are rights of people decreasing instead of increasing. And, I thought about how I can best serve and help my community. And, I was early 30s. I'm 37 now, but early 30s. And I said, if I don't try it now, I don't want to regret not trying it and trying to provide my maybe skills and expertise and time to bettering our community. And I also didn't think that the person who was representing us in the state senate was standing up for the values that I believed in.
Mm.
We're not standing up for the future that I wanted to live in. They weren't representing, marginalized communities. They were not supportive of, women's health care. They did not believe in the climate crisis. All you kind of tick down the box. And the district, I'll close with this, the district was drawn for him, actually. He was an assembly person and they drew in the last redistricting cycle a district for him to run in the state senate. And, we really had no business winning that first race by the numbers. And, we were able to kind of meet people where they are and talk about the issues that matter to folks and talk about solutions also to the issues that matter to folks. And that's why I wanted to run, was to help bring people together and actually figure out in that uncomfortable middle space like what we can do to make a difference. And we have a great team and I'm really glad we did it.
Yeah. So a couple of questions come from that response. Specifically, I'm so impressed at how few politicians these days use the expression public service as a part of the impetus to enter politics. It's become such a world of otherizing and saying I'm just going to run because the other guy's not doing what I want to see happen. But it's not about true public service. So thank you for mentioning that, because that so clearly was part of your inspiration. But I also know how hard you work. You are a very busy person, as I suspect your father was a very busy person. How was it being the child of someone who spent so much of his life as a public servant? And how did that, well, clearly it didn't discourage you, but I'm so curious what it was like, growing up around that level of work.
Yeah. I think I'm very fortunate. Both of my parents are steeped in public service and community minded. And my mom was, deeply involved in kind of forming my values and, how raising me and, being there for me and with me while my dad was serving his constituents. Right. But at the same time, I saw a deep work ethic there. Right.
Mm.
And as it was difficult for me, you know, even looking back on it, especially at the time, right, difficult for me to not have that time with him or to feel sometimes honestly kind of second to the job. I can see now and have seen for a while. Right now, I'm part of the reason why I'm able to sit here and want to pursue it. But I can see how much good he did
Mm.
for the community. And that's really meaningful. And as I said, I kind of ran from it, right? Because you see the negatives and your time is not your own and your family suffers from it. And even you know, you can never make everybody happy. But I really grew up through his experiences. I mean, the way we would spend time together is like I'd get in the car with him and we'd drive 3 hours to Ithaca to go to the chicken bake, right? Like that's how we would spend time together on a Saturday.
Mm-hmm.
You know, we would go back to school shopping at the Hudson Valley Mall, and a trip that, you know, should take an hour, maybe an hour and a half, would take 2 or 3 hours because he would stop and talk to everyone who came up to him. And, you know, as frustrating as that sometimes was for me as, you know, an 8-year-old, right? Like I still heard everyone's stories. And so whether it was, thank you so much, you helped my mother be able to stay in her home,
Mm.
or please help me, I can't get my veterans benefits, right? Like that really shapes and frames the way that you see the world, even as a kid when you don't realize it,
Yeah,
right?
of course.
And so that always stuck with me. And so when I say like I felt like there was more to do, it's because those stories were living with me.
Mm.
And I can remember the senior who called my house and left a voicemail on our answering machine, deeply terrified because they had turned off her electric and she didn't have hot water. It was middle of the winter.
Mm.
And, you know, we had gotten home and my mom just played the answering machine and that's what popped up. And so then that leads me to ask questions. Who is this person? Why are they calling us? What do you mean she doesn't have hot water? Why is, you know, and so that informed the way that I saw the world. And clearly, obviously, you know, he stayed with me. And when you see, especially kind of your whole life, you see those both inequities and the way to be able to help people in a real way. I think oftentimes you want to kind of continue that work and pick up the mantle and try to help as many people in the community that you call home as possible.
Well, it's so genuinely a calling for you because there are certainly children of busy parents who say, I'm not going to do that. Never, ever, ever. I can speak to my own personal experience. I don't think my kids, well, I know my kids have absolutely no interest in medicine and they're young adults, so they've made their choices already. And I think some of it's because they saw how much I worked. And it's not that they don't have a work ethic, but it was all about the, personal time often became professional efforts, running into people in grocery stores, just as you describe. So I like that clearly one, these were kind of firsthand experiences for you, hearing the woman on the phone, message. And two, clearly it was just part of your, not just exposure, but your DNA. So it informs your integrity so much. When I see you out there and speaking, it just is so genuine. So thanks for sharing that. I also wanted to thank you as a gynecologist for all the work you've done on women's health in New York State. Do you believe that women's health is inherently a political issue? And if so, why or why not?
You know, it shouldn't be a
Mm,
political issue, right? Women's health is healthcare, and healthcare is a right. We shouldn't have to distinguish between the kinds of healthcare that we're providing or do not or do have access to. It has turned into or has tried to be used to be a political issue. And, you know, I think we have to just, one thing that we try to do is just reframe this conversation as much as possible and remind people we're talking about healthcare. Like that's what this is. And at a time when we're losing access to healthcare, it's becoming more and more expensive, you know, whether it's fewer people getting into certain types of healthcare or we're getting Medicaid cuts, which jeopardize not just, you know, people's individual coverage, but also services in rural areas, including rural hospitals. You know, we have to do everything we can to keep it in the conversation to make sure that we're not not that we're not forgetting about it, but that it's not being removed from our lives,
yeah.
right? That so often things kind of get cut overnight. And so if we're not talking about it, we bear the possibility of waking up one day and saying, wait, what happened to equal access? And I think we see some of that. You know, we felt that speak for me and I think much of the community, we felt that Roe v. Wade was a protected right? We believed that access to an abortion was part of the lay of the land. And almost overnight, we were proven wrong. And so it should not be a political issue, but I do feel like it's something we have to talk about and make sure that people understand what it is that we're talking about when we're talking about reproductive health care and women's health care.
I wonder whether some of the conversations will become less genderized when you look at all of the healthcare issues that affect all genders. Whether then, particularly, penis havers will stop using gender as a way of being divisive, but instead will look at the overarching issues, like you mentioned, access, equal opportunity, payment issues, et cetera, et cetera. It will be an
Yeah. I
interesting
mean,
thing.
I hope
Yeah.
so,
Yeah, me
but I
too.
also think, right, a lot of this, they're still steeped in misogyny, right? I mean, if we wouldn't be talking about access to abortions and reproductive health care if we weren't in really a deeply seated making change, making headway. We're moving, lots of things have changed and lots of things are different, but we're still dealing with a system that is steeped in anti-woman, anti-female issues. And, I mean, just the other day I was reading about how how birth control is like riddled with toxins. And quite frankly, I actually stopped taking it because it was really screwing up my like endocrine system and I was having all kinds of challenges. I'd been on it since college
Yeah.
and mostly to do with acne, right? Like that was what and it worked for that, right? But like have all other kinds of issues. And I sat down one day and I was like, well, I'm using the generic version. And then I was like, well, this is made in India. And actually, what are all of these things that are in this? And, some of them are probably fine. Not my expertise, but I don't know what all this is. And no one can tell me,
Right.
right? But we wouldn't be having this conversation, especially in the healthcare space, which has been so dominated by men for generations.
Ever, forever.
Yeah. And healthcare research has been dominated by men for generations, right? And legislation, too, by the way, has been dominated by men for generations. And so women's healthcare, women's access, these kinds of the kinds of things if you are a birthing person, right? Like need to have or should have access to, it just hasn't been in the foreground. And so I'm hopeful with you, I think, to get to a place where we're talking more broadly about healthcare and healthcare access and inclusivity and equity. But we are still so much in kind of grounded in getting out of this more male dominated space that I think it's going to take a little while.
I have to tell you, every episode of GynoCurious, I say to myself before taping, I'm not going to mention the word patriarchy and I'm not going to mention the word misogyny. And I have failed every single time.
Well, I did it for you.
Oh, well, thank you, ma'am. Thank you. It's just uncanny because, yes, it infuses every conversation I have. I don't care who I'm talking to. And so, yeah, there's a lot of work to be done. And you're doing some of the work. So I want to start talking about that. Part of the legislative work that you're doing is about menstrual products and menstruation. And as a gynecologist, I talk about menstrual cycles all the time. It's just part of my lexicon. I can talk about it with anyone, anytime, anywhere. But for you, I'm just curious whether you're walking down the halls of Albany, whether, there are people who kind of can't even look you in the eyes when you start talking about bills that are related to menstruation. Is there still some?
Oh,
Yeah.
oh, totally. I mean, it's really, and I want to I want to answer the question, but I want to give one shout out on the legislation side. You know, we're finally leaning into things like menstrual product equity and these kinds of things because there are women in office who are talking about it and who experience it. It's all about lived experience.
Yeah.
I have colleagues, Senator Roxanne Prasad from New York City, Senator Summer Brook from Rochester, who are doing incredible work on doula care.
Mm.
And something that's never been talked about in the state legislature before, right? Because it was white men who were there, and it's not their experience, it's not their thing. It's kind of hard pressed to expect them to bring that forward. Would be nice, but not their table. And so that's why it's so important to have a diversity of people elected to office and to be in public office, because that's how we bring these things forward. It's not a knock even necessarily on, some of the folks who have been there. It's just that that's not what their table is. And so it's been one of the, kind of joys for me to be able to have some of these conversations really for the first time, or for some of the very early times, specifically including around, menstrual product equity. And again, Roxanne Prasad, she chairs part of the OTDA committee. It's been great to kind of work with her and kind of stand on some of her shoulders too and talk about it. But there, you're standing in the legislature and you stand up to do a resolution, either speak on a bill that we're passing or to do a resolution about like menstrual health. And everybody turns around, and you can tell people who want to come across like they're really paying attention, and they'll turn around and be like, I'm comfortable, and I'm, here. And then even though they may not, you can kind of tell they may not totally feel that way, but they're trying, and then others who are just, maybe on a phone or doing something else. But we have to make it, and over the years, I'll say it becomes more and more normal, right? The more you talk about it, the more comfortable you get. And also because it's deeply stigmatized for us too, even for women, right? I
That's
mean,
right.
growing up,
That's right.
never talked about it.
That's right.
It was something that was unspoken. People
Mm-hmm.
made fun of. You can't, I mean, oh my gosh. And so even for us, like I have my own stigma to get over, right? To be like, nope, this is healthcare. It's totally normal. And we have to work to destigmatize this conversation. And I find, a lot of inspiration. I mean, some of the young folks who are coming up now have really leaned in, and there's a group in Kingston. I always tout them, the TMI Project, who are totally normalizing the conversation. I've gone on their podcast before, and it's great, right? Because you shouldn't have to be growing up as like a person who menstruates, who has your period, and being really deeply embarrassed about life, right? And anything that we can do to help change that for people is really important. And so providing access to menstrual products is part of that conversation, which is, one of the places we've leaned into. And I think it's been making a difference.
Yeah. The Wall Street Journal, and I'm reading now, noted in 2023 a survey found that 1 in 5 college students had faced period poverty, a global and local health issue defined by inadequate access, education, and the inability to afford safe menstrual products. Almost 50% of college students surveyed had struggled to obtain menstrual supplies due to cost. Since 2019, the cost of pads and tampons has risen sharply, outpacing inflation and increasing financial strain on those who need them. As of July 2024, the average price of a package of tampons in the U.S. is up 36%, and pads have risen 41%, with menstrual product prices now surpassing food price inflation. This data is absolutely staggering to me, particularly since I just came back from the grocery store and, spent over $100 for, I think, 5 products or 5 things. So this brings me to your work on the bill that got signed into law requiring New York public colleges and universities to provide free menstrual products in campus restrooms. And also the bill's free menstrual products in state-owned buildings, S3866B, and menstrual products as part of SNAP benefits, S7315. Can we kind of talk about these bills? You've already spoken to the importance of speaking out loud about these issues, of normalizing them. We would both agree that unless we start telling girls, if we want to talk to girls about their menstruation in an open, honest way, we have to use anatomical language. We have to use language that's honest and straightforward. And our laws have to reflect that. Our grocery stores have to reflect that. So these bills are asking your colleagues to address these things. Can you talk about these bills, please?
Yeah, I love this package of bills. And there's one more actually that was the
Oh,
first one we did, which was free period products in emergency housing.
ah,
And that was signed into law as well. That was kind of our first foray into that. And then the public colleges in SUNY and CUNY was our second one. And now we have the bill for all public buildings and for products to be available as part of SNAP. The numbers that you read are staggering.
mm,
And we would hear stories too of girls and people who would miss school because they didn't have menstrual products because they're really expensive, or there was a stigma and they were embarrassed to buy them or go get one when they needed it. And either one of those things is a problem.
that's right.
So, two of the bills, the emergency housing and period products on SUNY and community campuses, have both been signed into law. In 2017, there was a bill about public education in our high schools, and starting, I think it's in sixth grade and above. And, we've really been checking in with our school districts to make sure that they're offering them. And we found in some places, that was in 2017, they're like just starting to,
Oh,
which is, I mean, mind blowing to me that this is where we are. But because we're talking about it in the media, because we're passing more bills, and because more people are empowered to have this conversation, not in the dark, but up front and center, it's actually putting pressure on, some of the institutions who maybe didn't want to invest in it for whatever reason. Now they have to because people are paying attention, which kind of goes back to the beginning of like, we've got to be talking about these things, because as much as we wish and want that things will just work in the way that they should work, they often don't.
right.
And so these bills I love. So the two bills that we're working on now is products in all state-owned buildings, and it would require OGS, the Office of General Services, to give us kind of a report after really every 2 years, but after launch, to tell us, how many restrooms they're providing these products in, if there's renovation needs, if there's funding that we need to provide, or what that cost is, but really rolling them out into all of our public restrooms. Nobody asks about the cost of toilet paper. No one asks about the cost of paper towels, right? Like, what are we doing here?
Right.
Why do we have to stop ourselves and say, well, what does that cost? We're not asking, it's a healthcare product. This
Right.
is what people need.
Right.
We're not asking about toilet paper and paper towels. We should not be doing this all of a sudden on period products and menstrual products. And so that's kind of my frame on the cost
Yeah.
challenge we get.
I was just curious, has there been any conversation with the manufacturers of tampons and pad products vis-a-vis trying to assist in having all of these state buildings have the product and not bring up cost? Or that cost isn't the obstacle, if you will?
Yeah, so I don't think it's the manufacturers don't raise the cost problem, and there's a whole responsible bidder process that we have to go through. Sometimes though, there's only one bidder because
Mm,
it's not up to now, not every restroom has had to have these products. And so it's not something that's offered by every provider, by every vendor.
right.
The hope is, and the belief too, is as this bill passed the Senate this year, we have to get it through the Assembly as well. And I think next year, I think they just ran out of time. I'm hopeful next year we can get it through both houses. But vendors see this coming. So they should be planning and starting to change their inventory, which will also help drive down costs from a bulk shipment perspective,
Right.
is my expectation. In terms of in-store costs, I think back in 2018, I believe it was before my time, maybe 2019, it was before my time. I believe the state legislature rolled back the pink tax, which was an additional cost on female-centered products and things that were marketed to women and girls. There was a thing called the pink tax. It literally, our products were more expensive.
Yep.
That was changed by the legislature. I think it was 2019 or 2020. I think it was 2019. But this is a product that, is inherently a like biologically female product. And so we would like to see those costs come down. We'd also like to see these products not have toxic chemicals in them.
Wouldn't that be a great thing? Mm-hmm.
There's a bill that my colleague Natalia Fernandez has. She represents the Bronx. We've passed it through the Senate a number of times. I'm a co-sponsor. We need that to get through the Assembly as well. But I actually just signed on to a bipartisan letter with state legislators across the country asking our federal government to really crack down on the types of chemicals and products that are in period and menstrual products. And so that was a bipartisan effort of women across multiple states to the federal government. And I'm hopeful they will enact there because it really shouldn't. I mean, it could be state by state, but ideally it would be at a national level and across the board and something that we don't have to worry about. But our other bill that is also kind of leans a little federal is allowing SNAP to be used for menstrual products. As you mentioned, it's expensive and it's also a need. It's a healthcare need for people. I'm concerned now with the cuts to SNAP that are coming, right? It's hard to add more things to SNAP coverage when people are getting less money and will need a waiver from the federal government, but it should be included. People should have means to be able to buy the products that they need. And we passed that through our House also in the Senate this year. It was a new bill, and I'm hopeful that we can get the momentum to pass it through the Assembly next year too. We've been able to expand the SNAP program to include things like at farmers markets, to be able to go to farmers markets and buy fresh, healthy food because everyone deserves to eat healthy food. It's also a form of healthcare. If you're eating nutritious food, you're spending less money on the back end in healthcare problems down the road. It can also help kids grow their brains and be able to form and foster good relationships, both with their peers and family members. So, access to good quality food is really important for everybody. And SNAP has been a long time bipartisan program that has existed forever. And it's one of the things that we're seeing some federal dollars cut in this last federal budget bill. But that's something we will, we believe in SNAP. Again, it's been bipartisan as long as I can ever remember, because poverty is not political, it's not partisan. It impacts everybody, especially rural poverty
Mm-hmm.
impacts everybody. And lots of people are dependent on this program, and we've got to figure out ways to fund it.
Yeah. So to reiterate, I want the audience to remember that women's health is health care, that our biology creates something called the menstruation. And there are many women who would choose not to have menstruation, but it is a reality in our lives. And the fact that women are being asked to pay more for products that they absolutely need, they can't go without, is in my mind, criminal. And, I remember so vividly being in the first restaurant. It was in New York City, where there was a beautiful basket full of tampons and pads. And I just remember feeling so happy, really. It is simply happy and proud of the restaurant. I actually went to the manager and I said, like, that is fantastic. You didn't have that ugly white box that you had to try to fit a quarter in, that the product typically would not come down the chute. And it's a wonderful thing. And I'm so glad that legislators like you in New York State are really addressing this issue. It's just so important. And if we could have this be a federal phenomenon, this would be good. So I want to just pivot a bit and talk about fertility. Fertility is not just biologic, unlike menstruation, if you will. It is also political because it touches on autonomy, identity, and power. Across cultures and eras, governments and institutions have attempted to control who gets to reproduce, when, and how, whether through restrictive abortion laws, regulation of contraception, state funded IVF or lack thereof, forced sterilizations or incentivized reproduction, disparities in fertility care based on race, income, or geography. So I know that you're working on issues around fertility too. And can you speak about the work that you've done, particularly the Expanding Equal Access to Fertility Care Act, S4497, please?
Yeah, this is a bill that I'm really excited about and feels pretty personal. You know, Healthcare technology comes a long way every year. And what we're seeing in the fertility space, I mean, between IVF and also being able to freeze your eggs specifically, this is a new technology that we have that allows people to take control of their own destiny.
Hmm.
It allows people to be able to determine when they want to have kids, to maintain the ability to have kids if you either don't meet your partner until a little bit later in your life, you're focusing on your career and you're unable, it's not the right time, maybe you don't have the economic security to want to be able to bring another being into the world, but you want to have kids down the road. Or later on, you decide you want to be able to have a family, you haven't met the right person, but you still want to be able to have a kid. The technology is there, and yet it's only accessible to people who have significant means financially, or if they work at a job that's really more like a tech job, right? Like one of the jobs that offers like deep packages with all kinds of benefits. And the normal, I'll say quote unquote, kind of normal economic mean job opportunities are not providing the additional access to egg freezing. On top of that, there's the storage cost too. And egg freezing in New York averages about $18,000 a cycle. And most people need 2 cycles. It's cheaper in other countries
Yep.
than it is in New York and across the US.
Hmm.
This is an equity issue. And, it's something I even looked at. As I mentioned, I'm 37. I'm actually getting married next month.
Yay. Congratulations.
Thank you. But, when I was turning 30 and in my early 30s, I was like, I'm seeing some friends being able to freeze their eggs and take control of, what their future could be and at least keep the door open and have opportunities and have options. And it was so vastly outside of my price range. And it became so clear that this is really a thing that folks who are incredibly wealthy can have, and yet the rest of the country, the rest of New Yorkers, but also really the rest of the country will not and does not have access to.
That's right.
And having control over your future is an equity issue, especially when that technology exists.
Yeah.
And that healthcare exists. So we put in a bill that would have commercial insurance cover the cost of egg freezing and storage. And I'll tell you, a couple other, I've seen one other, maybe two other states put this forward. We're one of the first. And I wasn't sure how my colleagues would react to it because any type of insurance mandate is tough or can be tough, right? And there's so many things that insurance should cover. And, that's a larger and a longer kind of difficult conversation.
Yeah.
And it just put it in. And again, I hadn't been able to do a lot of the legwork to really build a coalition that I think that we would need for something like this. And in speaking to the insurance chair and kind of bringing it forward as a priority of ours for this year, people in the Senate jumped right on it,
Mm.
which was really heartening to me because it's an access equity issue. And we were actually able to pass it through the Senate this year. And we are the first House in the country to pass this bill, this kind of bill.
Mm.
So I'm hopeful. Member Neely Rosick, she represents Queens, carries this with us in the Assembly. I offered it to her when we put it in. She carries it in the Assembly, and she's also excited about this bill. So it's going to be a priority for all of us going into next year, because if we can get this done, it would be a game changer for people across our state.
I want to also speak a little bit about this concept of global fertility tourism. That women and their partners are traveling to other countries to get access to fertility care cheaper. But again, this is still a cohort of folks who can pay for the travel and who have access to the information about the travel, who have the capacity to understand all the rules and regulations around getting your fertility treatment, whether it's in Mexico or in, I don't know, Thailand or wherever people are going. And the terrible irony is that this tourism market fertility tourism market is we know it's going to expand. It's going to expand over the next 10, 20 years because there's just too much money to be made. So why can't we in this country find some way to keep the, if you will, the capacity, the access, the financial remunerations here, not
Yep.
elsewhere? Yeah.
Yep. Well, it's exactly right. And it's an economic issue.
That's right. Exactly.
Economic
Exactly.
issue.
Mm-hmm.
We should be, I mean, at the, kind of the gritty baseline of that is like we should be keeping our dollars here.
Right.
We should be keeping as much money as possible in the States and in New York. And that's what we should be trying to do, supporting workers. That money goes to workers, that money goes to businesses, it goes to the restaurants around said healthcare facility, right? Those are dollars that should be staying local.
Mm-hmm.
On top of it, it's an economic issue for the folks who want to be able to control their destiny and have kids.
That's right.
They can stay in the labor market longer. They can stay in the workforce longer and be able to contribute, earn more money, have more savings, spend more money at, again, the restaurants or on vacation or in the school district or whatever it might be, and also be in the labor market and then be able to bring in a child into the world when they can afford to have one, when they can pay for all of the things that come with having a child. That's one piece. It also allows people and would want have people want to stay in our country and in our state. One of the things we can see it's cheaper to raise kids and have families in other countries as well. Can be. We should be making it as easy as possible for people here, especially in New York. And so, why wouldn't we want to provide this service to people? Not only because it's the right thing to do and because it's the equity issue and everyone, this thing exists now and everyone should have access to it to be able to control their own fate, but also because it's just good, smart economic policy.
It flies in the face of the science that I talk about a great deal on GynoCurious, which is that when women have options around their reproduction, it not only is good for the person, but for their children, their children's health care, their children's access to education, and then community. So it has this unbelievable ripple effect that has been demonstrated over and over and over again. And yet it seems to be lost in the morass of, well, I guess certain belief systems and points of view. So I'm curious what you think we have lost and possibly gained as hospitals and practices have become part of large corporate systems.
It's a challenging question. You know, on the one hand, being part of a larger system means maybe you have access to more opportunities. If your system in your rural area is also part of a much larger, well endowed system in, say, New York or in Westchester, and something happens in your community at your local hospital or near your healthcare practice, and you have to get somewhere with more resources and more expertise, you're already in that network. And so it's an easier synergy. Operating systems are all together. And so they have your information, they've got your paperwork, that's all together. But at the same time, what it seems like to me is we're losing that kind of one-on-one or the closeness and individuality of doctor relationships, right? And it becomes more and more expensive. The larger you are, it actually becomes more expensive to operate in rural areas and to be nimble and to have standalone practices. And there's a much longer conversation to have on why this has happened, why consolidation has kind of become the shift. And some of that is policies that have been put in place. Some of it is costs, some of it is where people want to live. There's a lot there, but we have seen a lot of our smaller doctors' offices be consolidated into larger networks. And then sometimes we lose services, right? Those services may get kind of consolidated into wherever the home of that entity is. Or people may not want to work, they may want to work in a more individualized place. They may not want to work in a larger corporate setting. And therefore, but if they can't make the economics work to be a standalone, shop in some place, they may not have the opportunity. And so, you know, one of the things that we're seeing, and I'm going to relate it to a bill that I have, is smaller hospital networks are being bought by larger hospital networks. And in those mergers or purchases, sometimes you lose healthcare. And it could be because that hospital doesn't offer it, or it could be because that hospital chooses not to provide that kind of care because of a hospital policy. And often the kind of care that lends itself to is reproductive care, abortion care, LGBTQ care, or even some end of life care. And that's really problematic when you're seeing smaller rural hospitals or just smaller city hospitals being bought by these institutions that choose not to provide that care. People may think that that care is available to them. The merger happens and they lose that care overnight, and they don't know that that hospital no longer provides that kind of care. Or it could be that that type of care, let's say a tubal ligation or a vasectomy or abortion or miscarriage management, those services may not be available to you for hundreds, plural, hundreds of miles if you lose it in that healthcare setting, which means you should just really never expect to receive that kind of care if you need it. And that's happening here in New York, right? We hear about other states with these horrific experiences of people not getting the care that they need and the care that they deserve. And we're seeing hospital networks choose to not provide that kind of care as well. From a state level, we believe in that care. We want that care available, and we're doing everything we can to expand it and expand upon it. But some private institutions may choose not to. And we have to get that information. So I have a bill, the Hospital Transparency Act, that would require hospitals to be transparent. It's in the name, be transparent about the kinds of services they do and do not provide based on a policy, not because they couldn't find the expert, but because they choose not to do it on a policy. And to give that information, to make it public for both the patrons of that hospital network and also to the Department of Health, so that we have insight into where there are healthcare deserts and healthcare, so that we can then invest in the places that we know need care and may not have it.
Yeah, I mean, particularly vis-a-vis, abortion care and access, even in our wonderful New York State. There are far too many women out in the periphery of this state who have no access to these services, who have limited access to any medical services, because there are plenty of places in New York State even where just finding a primary care doctor is extremely difficult. I think so much about this question about corporate systems because I started my career as this, kind of solo. I was in a small group, then I was solo for 15 years, and then I got bought up. And I think I've gone under like 5 different names until my last job where I was with an extremely large corporation. And compassionate, patient-centered care felt like almost an old-fashioned notion to them. I used to say I'd go to, more meetings than I ever went to as a clinician. And I don't remember a meeting where they mentioned patients or care or access. It was all about diagnostic codes, reimbursement, hours worked, EMR, all of the logistics of our day, and never about how are people doing under our care. And as you well know, not just from a patient perspective, but from the clinician's perspective throughout this country, folks are unhappy and they're not able to provide the care that they want to. that service, that the reason I went into medicine to help women heal and be well, not being able to provide that is extremely dispiriting and discouraging. And I'm hearing there is a greater attrition of clinicians from not only my recent work entity, but from everywhere across this country, because folks just don't want to work under these demands anymore. And it's not just because it's not good for them, but it's not good for their patients. And it's really hard to go in each day and try to make it work for the patient. And there's just so many obstacles to make it happen, you know? Yeah.
Well, right. I mean, when the financial bottom line is the sole driving factor, which it often becomes, and kind of the larger you get and the more entities you have, whether it's shareholders or investors, whatever it might be, the larger it gets, the more you're driven by profit. And that can be difficult, especially in a challenging and quite frankly broken healthcare
Yeah.
system
Yeah.
where you're tasked with giving people the care that they need, but our system may not reimburse you appropriately, quote unquote, appropriately
Right.
for it.
Right.
And therefore, you're disincentivized from providing that care, or the insurance company who controls so many levers. Now, the insurance companies are also buying the practices, right? And so you think you're going to a doctor, but the overlords of that doctor are actually the insurance companies that are denying your claim
Yeah.
that the doctor is saying you need. I mean, the whole thing is so out of whack and so stacked against patient care
Yeah.
that the whole system is broken. And it's no surprise that people are so fed up, whether you're a provider or a patient, and have no trust in the system. And then on top of that, you add the layer of the politicization of things like abortion care or miscarriage management care or healthcare for kids. You add that like polarization and politicization instead of actually thinking about and caring for the people that are at the center of it. And we end up, fighting with each other about the kinds of care that people in our communities need.
Yeah. Yeah. Oh, there's so many questions I have for you, but I know that you have to move on to the rest of your afternoon. And, I typically end GynoCurious by asking folks what gives them pleasure, but I'm going to ask you a different question because I think it's woven into this question. How do you inspire yourself, and how would you inspire our listeners to stay in it, to continue the fight, to have faith that our voices are meaningful, that our actions can impact, and that we will move forward? What would be your parting words around that?
Yeah, I think we have to keep the faith and we have to be involved. If we are not involved, someone else is going to be,
Yeah.
right? Someone else is going to be making the decisions. Someone else is going to be creating a rally. Someone else is going to be pitching the stories to the local papers or the podcast. Someone else is going to be controlling the narrative.
Mm,
And if we are not telling the stories of lived experience, if we are not standing up for ourselves and our neighbors and our community with what we know we need, then we're probably not going to get it. And there are some really beautiful stories of important wins here, right? We get so bogged down in the chaos and the, understandable fear and the challenges. These things, especially in the healthcare space, feel both deeply insurmountable and like the deck is stacked against the change we actually need. And yet we're able to make really good steps forward, whether that's having people, even with the onslaught at the federal level and the craziness that we're seeing in other states, people in New York, because of the folks that the community has elected into state level positions and state legislature and statewide positions, we still have access to reproductive care, right? And that is a value that we all believe in deeply.
Mm-hmm.
We stand up for our LGBTQ family members and friends here in our state and have done legislation on both of those fronts that are models for the rest of the country. We have our egg freezing bill, which is the first one in the country that moved forward. Only one no vote on that bill in the entire Senate chamber,
Wow.
right? One no vote on that. Get him out of here. One no vote. And that, like, if we can get that done, that changes the game on how we talk about fertility too, right? And so, but that only happens because someone like me is in the legislature who's looking around saying, oh, I have one friend who can do this, and I have a lot of other friends who can't. And that is in an equitable system
That's right.
that I'm living in right now. Right. That only happens because of the work that we're all doing collectively. And so while it can feel really dark, there is so much good work happening. And if we remove ourselves from the conversation, we can't control that. But if we stay in it and we stay hungry and we stay engaged and hopeful, that's how we bring people with us and make lasting change that will actually benefit the communities we live in and beyond.
And ripple effect that if we can act locally, that can impact change nationally and globally. So
Absolutely.
thank you. Senator Hinchey, you are speaking about menstruation out loud, fertility out loud, women's health in a way that normalizes and invites folks to talk about it in a respectful way. So thank you, thank you, thank you. And I'm so grateful you could join me today. And
Thank you for having me. And thank you for your work. It's so wonderful to join you and to have these conversations with you. We've got lots more to talk about.
so
So
much
that'll
to
be
talk
loud
about.
too.
So have a great wedding. May it be a beautiful day. Having been wedded in the rain and still married after many years, it's a beautiful thing no matter what way it goes. So thank you and be well.
Thank you.
And thank you to my co-producers, Jen Hammoud and Maddie Rosenberg, and to my editor, David Hoffman. Until the next episode of GynoCurious, please stay well out there. Listen to your instincts and intuitions. They are the greatest of teachers, not to be ignored.